thing. So hi everyone, welcome. I'm really happy to welcome you in this session, online and face to face. We have 4 presentations today, 15 minutes each, and we'll take questions also, of course. So I'll just introduce our first speakers, Sandra and Chantal, who will speak about Fairlink, the DLI training repository. So a few words about you. Sandra Sawchuk is the Data Services and User Experiences Librarian at Mount Saint Vincent University Library and Archives in Canada. She's a regional training coordinator for the Data Liberation Initiative and the former member of Portage Alliance's curation expert group. She has an academic background in digital humanities, and her research interests include data reuse and data rescue. She recently co-authored a paper on computational reproducibility, and she's currently participating in a 2-year grant to improve access to Canada's historic census data. And Chantal Ripp is a research librarian at the University of Ottawa in Canada. Data services, data literacy, and government information are her main areas of responsibility. She is a member of the university's RDM advisory group, responsible for developing an institutional strategy. She is also a member of the DLI Professional Development Committee and the Digital Research Alliance Data Management Plan Expert Group. She is a contributing author to the Carl Portage Network Guide to the COVID-19 Rapid Response Data Sharing and Deposit for Canada Researchers, as well as RDM Maturity Assessment Model in Canada. So the floor is yours.
Thank you. So we are screen sharing. So we're using this presentation here. We're just using a more recent version of our presentation. Will the audience be seeing this screen here? Yeah, okay, wonderful. Hello, everyone, welcome. I'm just gonna start my timer because I love, yes. Okay, so I'm gonna screen share here. Yeah, thank you. There we go. Wonderful. Welcome, everyone. I'm starting on this page because we have created a website for this presentation that has some of our resources and links and the abstract, etc. I always find that I take very poor notes at these conferences, so I like to provide, a URL so that you can just click on whatever it is that you want. So the URL is on the front page of the presentation, which I will expand right now. So please write it down. And if there's anything that we say that you enjoy, you are welcome to use and share our resources and get in touch with us. We are here to talk about the Data Liberation Initiative Training Repository. And for anyone who likes soap operas, I hope you get a kick out of the title. It has to do with Days of Our Lives. So we're so glad to be here to talk about this important work that we're doing. Our training repository has been around for quite some time, and like all repositories, sometimes they need to move. So we're here to talk about that, to give you a bit of background about the Data Liberation Initiative, to talk about some of the principles in regards to the fairness of the repository, talk about what we did technically, and give you some key takeaways. Okay, good. Thank you. And this is our project team. So myself, Sandra, and my co-presenter Chantal were the only ones fortunate enough to come to Sweden, but we did not do this work alone. So there are other members, including Alexandra Cooper, who was a virtual presenter in one of the last presentations, or a team member, Margaret Vail, Jane Fry, and Sarah McDonald, who is a student assistant who's helping us. So we're bringing up the next round of data folks. And I'm going to pass it off to Chantal.
Thank you, Sandra. So I'm going to give you a little bit of a background. The Data Liberation Initiative, it's a partnership between post-secondary institutions, and currently there are 77 members, and Statistics Canada for improving access and use of Canadian data. So part of our program, there's been a long-standing model of a train the trainer. And early in our community's train the trainer model, there was a need for us to curate presentation materials that we were delivering at regional and national training sessions for reuse by members of our community and others. So this started, as Sandra had noted, maybe about 20 years ago. We started with a repository in the University of Toronto, and it moved, I believe, in 2011 to Carleton's Kudo repository, which I think in the backend system was DSpace, and it's now necessitating a move as well. So the Carleton institutional repository that we are on is on end of life, and we saw an opportunity. So unfortunately, practices change, and there was some clunkiness for which we saw an opportunity to address. When the repository moved to Carleton, the data deposit moved to our partnering entity at Statistics Canada to do the data deposit. And for them, it was more of a way of facilitating a one direct shop, so you can get one entry of records so that members participating in these regional training sessions can go and click and download the materials. While it meant that information retrieval needs, it really was very limited. So as you can see, there's no description of any of the presentations that were shared, no attributions to authorship, no unique identifier. And when you attend a presentation and your colleague gives you permission to reuse it, you want to attribute that work. It's very difficult to search and retrieve something when it was deposited this way. So as I noted, there was limited search capabilities, no keyword tags, very limited metadata, inconsistency over time. We have these, what we are referring to as mega entries. But in the past, each object was deposited individually, and we saw some advantages to that as well. So again, a fresh start. One of my favorite shows. So with the fresh slate in front of us, we were looking for a solution that would meet our community's needs. We had articulated that the way the repository is being currently maintained was not really meeting what our community wanted. And we wanted to ensure for long-term preservation and reuse of these materials, where we're like, okay, let's set this up in this new repository that is going to be preservation friendly, meeting FAIR principles, and allowing us to be able to reuse this information. So we undertook at first a comprehensive review of the materials that were in the repository, and I'll quickly talk about that a little bit after. A needs assessment of our community. So we actually surveyed them and asked them, what do you like about it? What don't you like about it? What are your current practices for search and retrieval? And how can we envision a different way of developing new learning resources that would meet other needs? And we did an environmental scan of the current repository solutions that we could potentially leverage. So we were able to cull a lot of the metadata and kind of look at what was in our collection. As I said, it's not evident at a glance in the repository because there's different practices of depositing the information. So we have nearly almost 2,000 records, many different subject terms, and that's a lot, and 14 different file types. And one of the things that we had realized is that there are different legacy PowerPoint presentations that we couldn't even open that had very important information that we wanted to be able to share. And as I said, it goes back to like 1997. So this presented not only learning objects we wanted to see for reuse and repurpose, but it was also insight into, in our data community in Canada, the evolving themes. Like we could see in 2007, the first presentations in our area around research data management. So it was a good insight into the evolving practices in our data community. As I mentioned, I won't go into the details. We surveyed our community. We had over a third response of our entire survey community, which I think was relatively high. And they told us, we shared some ideas and they agreed with us. They, rather than depositing it by location, they wanted learning paths and being able to identify location by actual different facet opportunities. And we looked at a couple of options, OSF, the Open Science Framework repository, way too many bells and whistles, didn't necessarily meet our needs, didn't have DOIs. In Canada, we also have the Federated Research Data Repository, a great platform, a little bit of too much of a mediated access for our needs, and of course, Dataverse. And I'll pass it back off to my colleague, Sandra.
Thank you so much. I'm just checking on our time. So as we all know, fair data are important. And though our data set is not necessarily traditional, in the sense that there are variables and so on, it is comprised of presentations, again, tracing the history of the Data Liberation Initiative, as well as providing really important training materials for our new members. So we wanted to ensure that our data were fair. Now, the Dataverse platform really meets all of these needs, and Dataverse is changing all the time with new features. So through our environmental scan of the available repositories, we really found that Dataverse was the perfect solution for us, despite the oddity, I suppose, of the materials that we are depositing. Dataverse generally is for data sets, tabular data, and other types of data. Our presentations, though, don't necessarily fit the mold. So we consulted with the Dataverse administrators at Scholars Portal. We'll talk briefly about Scholars Portal later. But Scholars Portal has, been working on a national initiative to provide instances of Dataverses to universities and colleges across the country through formerly known as Portage, now known as Alliance Network, called Dataverse North. So we're really moving in Canada towards a consolidated network of Dataverses at the university level. And we felt that our project was a perfect fit for that, seeing as how the Data Liberation Initiative librarians are working out of universities across Canada. So we were really happy that the deposit into Dataverse was possible. Here on the right side of the screen are some of the FAIR principles that Dataverse meets. So Dataverse mints DOIs with versioning, which is really important for us because of citation and attribution of our authors. We all know as librarians specifically that getting our work to be cited can be a challenge, and the type of work that we do is quite different. So as a benefit to our community of librarians, the DOIs that Dataverse provides will really help our progression through the ranks in our own universities to prove the impacts of the work that we are doing in research and service. The Dataverses are much more, have a much more robust search features with faceted searching. There are opportunities for us to organize our data into smaller Dataverses. As we mentioned before, we're planning on using learning paths. The data are described through robust metadata, and those metadata fields can be formed into a template, a custom template, so that our community can deposit their own research with limited mediation by our team. As we all know, when we work on committees, we're doing this work along with all the other work that we have to do. So we don't have really the opportunity to mediate all the deposits. Licensing is available. We are using an assumed license, assumed copyright for our deposits. So rather than our content creators opting in, they have to opt out if they don't wish for their materials to be shared. The pages are accessible by others outside of our community. In fact, when it's in the Dataverse, they're really discoverable by people that are not necessarily affiliated with the DLI, which is a good way for us to advertise to other academics that we exist. It's also very file format preservation friendly. So some of those file formats that we are, having to deposit will go in there, and it meets all of the relevant domain standards. I'm going to talk now about what we did. So, we are a team, as you saw before, and we really wanted to have a collaborative approach, though it was important to have one head chef in the kitchen. I say this because it's even though it's only 1,600-ish records, one person needs to be in charge of moving these records, assigning work and direction, etc., and outlining clear roles. As much as we love to collaborate equally, it was important for us to have one person in charge. We also conducted a literature review to inform our migration plan, and those references are in our webpage. So I invite you to look at them if you're conducting a similar project. And we needed to ensure that we didn't mess it up. So despite using the versioning available in Google Sheets and some other tools, we kept a lot of backups, and that was the job of the project manager. Because there were some errors made when you collaborate on spreadsheets. Sometimes extra columns are added or deleted, or we decide that we want to go a different direction. So versioning sometimes isn't enough. So, and one thing I learned is that you can lock columns and other things in Excel just in case. So keep that in mind. The cleanup was quite large, and it's ongoing. We're not done. So we got the repository files from the Kudo Dataverse using wget, which is a command line interface. But obviously Kudo gave us the metadata. We didn't just steal it from them. They gave it to us in a CSV file. From there, we used a combination of OpenRefine and Google Sheets to clean the data. OpenRefine was really used for normalization and for data checking, and for some of that fuzzy matching and text analysis that OpenRefine uses. And I did some really cool gymnastics with OpenRefine and transposing columns down and up. And I have actually a list of all of the steps that I used with the GREL language, the regular expression language, if you're interested in swinging, transposing up and down. It was quite acrobatic. And, Google Sheets was used for the cleanup just because it was so collaborative. And I find it's easier to collaborate in Google Sheets than it is in Excel, even though Excel has those features. We needed a crosswalk. So thanks to Cooper et al., we used the Dataverse North Metadata Best Practices Guide to create a guide for our own metadata to crosswalk the data, because the Kudo data was mostly in Dublin Core. Some of Dataverse's metadata is in Dublin Core, but some of what Kudo used wasn't. So we had to do a lot of matching, and we're still working on that. It's taking a long time. But going forward, we'll have a template in Dataverse, and that's what makes Dataverse just so robust for us. Like I said, it takes us out of the deposit and puts that in the hands of our community while keeping the metadata consistent going forward for that findability for the faceted searching. Now, here is a prototype of what our Dataverse will look like. It's in a demo Dataverse right now. So luckily we can experiment endlessly because the demo Dataverse does not mint DOIs for real. We are uploading the data to the demo Dataverse using the Dataverse API, which ingests structured JSON files and brings the files along with them. Our demo Dataverse is live right now, but we're not really inviting people to look at it because it's not for real yet. But it's a really, once you figure out the code, it's quite easy to get a large batch of data in there with very limited intervention. So that CSV file will be transformed into a JSON file, which will pull the actual data set files into Dataverse automatically. And we're working with Scholars Portal on that. A note about that, like I mentioned earlier, Scholars Portal Dataverse is rebranding to Borealis. And you can see their lovely logo there, typical Canadian fashion. So our takeaways, and I have 1 minute to deliver these takeaways. We found that it was important to become familiar with our collection. We spent a lot of time just looking at what we had, and that historical deep dive, it was not only fun for us, but it really allowed us to ask our community what they needed, because it's very important to understand not only what you have, but what your community needs. That's why we were so excited about the opportunity, because the current structure of the repository was not meeting our users' needs. I know we say this time and time again, talk to your users, but talk to your users, ask them what they need. We did a lot of experimentation, and that's why I mentioned all of the versioning on top of actually saving checkpoints of the files. I can't tell you how many times I started over just myself. I love Excel, so it wasn't frustrating, but it's okay to experiment. The project's taking a little longer than we thought it would, but that's okay. And finally, Chantal and I have both talked about this a lot. If you want to give the closing words on this, because I am the one who's being the perfectionist, so.
I'm sure you've heard this expression before. We are both actually quite perfectionists and many members of our team, and we struggle with perfect being the enemy of the good. So the intention for us is to get it up and get it live and not nitpick on every keyword, every description, everything. So that is probably our own fault and delay of the project, but we anticipate it being live very shortly.
So you have our URL, and the last thing we want to say is that there is a photo mat in the coop over by Freehamen, and I highly recommend you go over there and they print out the photos on paper and email them to you. So welcome to Gothenburg. We're very excited to be here. And thank you so much.
Thank you. Thank you. Thank you so much. Would you like to have questions now or in the end?
Is there any questions?
Yeah, are there any questions? Yeah, I just, can you hear me when I speak in this mic? I don't think so. It's not working. It's working. Oh.
Hi, thank you very much for the lovely presentation. I was particularly interested by one of the last informations about the ingests into Dataverse of information, and I would like to know more about how you did it. So did you ingest XML files? Did you ingest the CSV only? And how did you create the scripts that allowed for this? And then finally, is the script somehow available for people who are curious about it or would like to use it?
So our developers were unfortunately not able to join us today, but basically the CSV file is transformed into a JSON file. Now there are a number of command line interfaces that you can use to do that. Obviously CSV is not nested the way that a JSON file is. So there is some wrangling that needs to go in there. The biggest piece of wrangling that we're having to do is to create an author profile, because we're adding ORCID IDs to the author names and also institutional affiliation and perhaps email address. So we're definitely needing to create, a structured data files for that. The Dataverse API is quite robust and their developers are very good at what they do. So we have been working with them to create the scripts. The scripts have been written in Python, but with some experimentation into the demo Dataverse, we've been able to try again. So we're very thankful that we have that demo Dataverse. So we're not just creating all these random DOIs. But between what's linking the metadata file, the JSON file, to the independent, like the actual files themselves, is a persistent identifier between the two. So we're using the file name. So the file name is part of the metadata and the file is named that name. So with some relative file naming, the API calls on that persistent identifier and pulls it up with all of the metadata. So please take down the URL of our website, because we will be posting these scripts. We've been experimenting up to even yesterday, to be perfectly honest. That's why we're still in progress. But once we have that in something that is really good, we're going to post it on our webpage. And you can see when I scroll down here that we have a number of references there. We have a document for cleanup steps, which included some of the OpenRefine regular expressions that I found to be quite useful. And we also have a migration checklist and info sheet that came from this bridge to haiku reference that you see further on down the list. So please, we invite you to take what we have. These resources are in Google, so take them, save a copy for yourself. And once we have the perfected version of the code, we'll be posting it here. And as librarians, we love to share.
Thank you.
Thanks for this presentation. It was really cute too, which helped. So could you talk, and this might just be my ignorance, but a little bit more about the data liberation initiative and also who the anticipated end user for the repository is? Are.
Sure. So the Data Liberation Initiative, as I mentioned, is partnership, and we have what are called DLI contacts at each institution. So it pretty much spans most of the universities across Canada and some colleges. And while the train the trainer model is to train up data professionals in each institution, ultimately is to repurpose those training materials into a classroom. So for instance, we've had some colleagues who are very proficient in R, Excel, and others, and they create workshops that we get to participate in, like our workshop on Tuesdays, with the opportunity to repurpose those in our own environments, our local environments. So while it is a training model for data professionals, we leverage that information that we can use on campuses.
Thank you.
I'm just going to show you our training site. So we actually have a training site because we host right now a national training. We're affiliated with Statistics Canada, Canada's National Statistical Agency, but we're doing another virtual event this year. We don't have all the details, but we have an event archive and some resources about the DLI and about Statistics Canada and stuff on the stem of that webpage that you may have written down. So we welcome you to contact us about our, consortial arrangements that we have. So no problem.
Thank you. I'm time conscious, so we have to move on, but so maybe we can take some questions at the end. I also have a question, but I'll ask it in the end if we have time. So our next presenter is Kathleen Weldon, and I invite you to share your screen. If it's working, I'll just, yeah, it's working. Great. So Kathleen is the Director of Data Operations and Communication at the Rutgers Center in the United States. She manages data provider relations, oversees the data curation process, plan archival development, and works closely with the IT development team in building new user tools. A graduate of Wasteland University with a BA in English, she started her career in public opinion at Harvard University, designing surveys with media and foundation partners. The floor is yours.
Thank you. Can you hear me clearly?
We can hear very well. We'll just put in the chat 2 minutes before the end of your talk, a little something so that you know.
A warning. Okay, so I try not to go over.
Thanks.
And forgive me if my if I am clearing my throat with frequency. I am recovering from COVID like so many others. So thank you for coming here to hear this today. I am Kathleen Weldon. I work for the Roper Center for Public Opinion Research, which is an independent nonprofit that lives at Cornell University. We're the oldest social science data archive, as many of you know, and we have 2 aspects to our collection, primary. A data set collection, but also a question bank known as iPoll, which includes over 800,000 questions and aggregate results from primarily US national polls. And I'm here to talk to you about a project that is based on that question bank called the Health Poll Database, which we have recently launched. Oops, maybe not that. Click. There we go. Okay. So one issue that has always been a problem that we need to address to expand our user base is the search function in iPoll, which works on a keyword search within the text of questions and responses. So we do have some topic assignments. They're very underused and they're very broad. The topic assignments is about 120 of them. And you're talking about over 800,000 questions that cover everything that's been in the news. The data goes back to 1935. So you're talking about huge changes and shifts in language and in content. So getting people to use topic assignments is one challenge, but even within the topic assignments, they just aren't granular enough to be valuable to a lot of people. And so many of our users are very comfortable with public opinion polling. They're political scientists. They've used a lot of this data. They know how things are worded, and they can go in and make educated guesses about what they are likely to get searching those question texts. Users who come from other fields do not have that advantage. They often go in, there's sort of two levels. There's the beginners, the undergraduates. They tend to use sort of language that is a little too loaded, that a pollster trying to write an unbiased question is not going to use, like Obamacare for ACA. And advanced researchers from other fields want to use the terminology of their own field. So they will go in and search something like social determinants of health, which no one has ever put into a question for the general public, I hope, because the general public would have no idea what that person was talking about. So in either case, they're not getting back the results that they need. And I think it's become very clear over the last 2+ years that it's very important for people in health to know about public attitudes and opinions and beliefs and knowledge and behaviors. And these are the sorts of things that they could learn using the survey data that we have in the database. So luckily, before all of that hit, the Robert Wood Johnson Foundation had given us a grant to build a portal into just the health-related questions within that larger iPoll database. And what they wanted to do was increase access. So there is a limited free access to this resulting portal. They wanted to make finding and using the data easier. They wanted to show change over time. They wanted to do some education. The change over time, I'm doing a presentation tomorrow on trends. So if you want to learn about that, that's then. But this is going to be about how we made it easier to find the questions that people need. So we need to build a taxonomy. And the opening stage of that was a matter of realizing that the existing taxonomies around health really weren't appropriate for the level of granularity we needed within the limited range of what polling covers. So generally, they were either covered far too much sort of clinical health topics, or they just weren't narrow enough to give any sort of helpful information. So we thought about the organization of a hierarchical taxonomy, and we looked at schools of public health, how those were organized, how they broke them down. ICPSR, what do you guys do? The Robert Wood Johnson site itself, their key initiatives, the way that they've organized their materials in the past, UNESCO's vocabulary around health. And then my favorite piece, Hazel Erskine, who is a bit of a hero of mine. She was a public opinion researcher who did the poll trend review articles on particular topics, polling results over time for Public Opinion Quarterly for a couple of decades. And to do this, she compiled her own proto-iPoll using microfilm and index cards and her own set of topical categories. And researchers would go to her home in Nevada and go to the basement and go through her index cards and find their questions and retrieve them on her microfilm. So we have her collection, and it was actually incredibly useful working off of her cards because it was exactly the sort of design that we needed. Of course, it didn't cover anything that had emerged since the 70s, but it was surprisingly comprehensive and helpful. And we created a long list of terms. Then we had to go to the experts. So we were not experts on health policy. So we needed to turn to people who were. We had an advisory committee made up of people from the Kaiser Family Foundation, Harvard School of Public Health, RAND, the Robert Wood Johnson, and several people from Cornell. And they worked with us. We met monthly throughout the 3.5 years of this project. But the initial kickoff meeting for the taxonomy work was in person. And what we did was take all of those terms that we had found and we put them on cards. And then we got a big conference room with a lot of cork boards and we let them walk around, pinning the cards and reorganizing them. And we got to listen to many very detailed debates about health policy and concepts within health policy and public health and health systems. And ultimately, I think we started with 10 top level categories. Ultimately, we ended up with 6. Policy and politics, social determinants of health, finance and costs, healthcare systems, public health, and one that isn't showing in that middle image, which was conditions, disease conditions and behaviors. So those ended up being the top 6 categories with some subcategories within. And then for the afternoon session of this meeting, we distributed questions, multiple copies of questions so that different people could choose to put them in different places, and no question is necessarily tagged with only one category. They can cross categories. So people were walking around, putting those questions into different buckets, and this was an incredibly useful exercise. By the end, we had our structure. There was a lot of refinement that needed to happen, but we were well on our way. We wanted to make sure that people used the structured language search. And this is a problem. People see that beautiful little keyword, Google style open field, and they will just type into it. It's very hard to get people to choose a topic drop down and go into that for their searching. So we wanted to create a tool that presented the topics visually in a way that was engaging, easy to navigate, and attractive. And we also wanted to use something that could represent this idea that RWJ is trying to promote of understanding how many things connect in health. Everything connects in health. So we thought about a node network that would show connections, and we looked at a few of these online. And then we started a sort of iterative process. We created an initial that the boxes looks very much like a replication of what we had hanging on the cork boards. We moved into something circular with more relationships. We started using the size of the nodes to indicate the quantity of questions within an area. We chose colors to represent the 6 broad areas. And finally, what we ended up with was this, which is our visual search interface. You can see that there are the 6 areas. We have little icons to help make that really quick to see. There are also these pale blue or lighter blue, which represent those things that just do not fit between categories. They touch too many things too intimately. So insurance, for example, which is here, insurance is equally a healthcare system question and a finance question. No matter what you ask about insurance, it's going to touch on both of those areas. So we have some items that just cross, and those are the multiple category. We have this category details. So this indicates it's a little bit of education here about the sorts of things, what this means, why are these things here, particularly useful in the social determinants of health, where there are things that people might not think of as being related to health, like housing and discrimination, transportation, but also some examples of questions. And then you can immediately navigate to the questions within that category. And the home page does allow for the sort of a traditional interface on the left, but the right is very open, very colorful, has the cute little icons. It draws people's eye, and having gone to a couple of conferences now and let people play around, they do go to it first, and we're really pleased about this. So we were at the American Public Health Association, and this over the weekend we were at Academy Health, the health policy conference. So a lot of these were people who had no idea what ROPR was. They really weren't used to public opinion data, but they were able to navigate, and they did start with those health topics. So they're really pleased to see that it was effective. Oh, I forgot that I had put a little video in here. Okay, so this is how it would work. You click through, you can see the whole thing. You can zoom in on social determinants. You can select, go look at that category detail, go to the questions. And then if you've used iPull, this should look very familiar, that there are questions starting with the most recent. You can click into the questions, get the top line results. And you can also get trend results with these pre-built trends on questions that have been repeated over time, the number of questions and the interview dates. And you can see those categories are still listed there to help people use those categories, get them into their heads, get them into their, get them comfortable with the structure of those categories. And just to give a quick example of what that looks like, click, you could see there's your trend, and you could grab that citation, you can grab that image, you can grab the data package. So then we had to categorize the questions themselves. Am I at my 2-minute point? Is that what I'm saying? 3 minutes. Okay, I can do it. I can talk fast. So categorizing the questions was, of course, not easy. We started by doing it with very targeted searches that would allow us to identify a lot of questions, add all of the tags to those at once. We went back to the committee again and again and again to refine the taxonomy when we had questions we weren't sure where they belonged, and that really was helpful. We started with spreadsheets, which were awful, but necessary, but our IT team built a tool to search for questions and tag them within the system, so we could grab many questions at once. It's very common for questions to be repeated, which is why we have trends, and those questions could be identified all at once. So here is our tool, put in STDs, and you get all the questions about STDs, 34 questions. This is a single instance of a question, but if that question had been repeated, you might see a different number here. You might see 10, you might see 40, and you can choose either individually for each question, the categories that go along with it, or you can choose categories. You could choose sex and reproductive health for everything that mentions STDs and assign them all. So this made it more efficient to tag. It's an ongoing process. It's always an ongoing process. We did an audit. Again, we just really recently released, so we just finished up. And we did an audit and noticed that, yeah, there was some problem with cross-coder reliability, partly because of that iterative process. Things had changed slightly, but we also had 5 different people doing the tagging. So we tried to start the unification process, identifying either identical questions or questions that have been put into trends, which were nearly identical and identified as the same question. We're still adding new questions. So there's a lot of data there. At the moment, there's 85,000 questions in this. There will be probably, I'm guessing, somewhere around 100,000 when we complete the backlog, but we're adding new questions every day, and there's a lot coming in on health because of COVID. And we're adding some, we have 2 new elements we hope to make maintenance easier. One is simply identifying those duplicate questions and just adding the headings from the existing version so that we keep it as consistent as possible, and possibly using AI. We're not sure how feasible that is, but at least to give suggestions of possible headings to try to limit the variation, even though it would require human intervention. And of course, a yearly review and update of language and headings. New things emerge. I'm sure there will be questions about monkeypox in the coming months. There were no questions about monkeypox to this point. But also language changes. Language is always changing, and we want to make sure that we are keeping up with the language that's being used in the field. And with that, I can stop sharing.
Thank you so much, Kathleen. It's really impressive. Do we have any questions? If you have questions online, just raise your hand and or write them. Yeah, there's a question.
So Bob Ray has a question.
Yeah,
Have not yet, I love the way you described it, not yet subscribed to iPol. That implies that you all will eventually, and that would be lovely. So the free access that RWJ built into this, the way it works is on sort of a media model. So you get unlimited searching of the questions, and that's actually pretty valuable because what you can see is all the questions that have been asked on a particular topic, who asked them, and when they asked them. If you're an advanced researcher or just a smart person, that should get you going, even if you can't get in and see the results. It's a really important set of piece of information. But we also allow 15 question result views. So that will bring you into that question, give you that chart. Cross tabs are involved in that. If we have cross tabs available, you can look at that. That's part of the one view. Per month. At the end of the month, just like going into the New Yorker and hitting your limit of articles, it renews, and now you can look at 15 more questions. On the trend side, there's simply a certain number of trends that we denote as open access, about 20, I think 25, somewhere in that range. We have over 350 trends, so it's not a huge number, but we've been trying to move them around according to things that are in current debate. So when horrible things happened over the last couple of weeks, we opened up some of the gun control trends and the abortion issues, right? So we added some abortion issues. Can I say anything about the technology? Boy, I can't. I can tell you who can. Gene Wang is our IT director, and he was really the person who worked with it. It is an existing toolkit. It is not internally 100% internally developed, that it was internally tweaked, but I can have him get back to you on that because I'm afraid I was all about content and not so much about technology.
You also have a comment from Jane. I think it was above the question from Ryan.
Well, I'm glad that's good. Yes, 15 peer reviews. It's not a ton, but for the casual researcher, I do think it's useful. We talk to a lot of people, public health conference, who, they write the occasional grant and they want to be able to say why this issue that they're dealing with is important. People experience it, they're worried about it. They only need a few questions. They only need a few items to fold into that to be useful for them. So I do think that the 15 a month is not huge, but it's enough for the more casual researcher. And as far as pricing for membership access, we really are trying to keep it as manageable as possible. Part of the point of this is to make it better to use, but also to cut off a piece from iPol and allow people to buy just the part that they care about, so we can make it a little more affordable.
Okay, we can still take one more question or two if you have questions.
Yes, it was just to know on the website, where could information be found on the surveys themselves? Because you can see one question being asked in multiple surveys, and so there is a trend. But if we want to know, for example, the number of people interviewed at this survey or specifications relating to sampling, these kind of things, where would this appear on the website?
So there are, on the individual question level, one of the things we do try to do at Roper in general is make every question independently understandable. So some very basic information like sample size, target population, sponsors and survey orgs, the dates of the field work are on every question. You can find them on every single individual question. There's also a tab. When you click into a question, there will be multiple tabs across for the study that it was part of. So you will see the study information page has more extensive information depending on what we have. And if we have the data set download, there's also a full documentation for the data set, which often includes quite extensive methodological information. So it varies a little because a newly released question from CNN will not have a particularly extensive methodology in the initial release. When they finally send us the data set, it will be much more extensive. So for that period between the release, when we put the questions in, because we put the questions in based off of public releases, it goes in right away. We want it to be up to date. We want it to be comprehensive. So those questions will have a relatively limited, but it does all meeting disclosure standards set for top line release by the American Association for Public Opinion Research. So they all meet that baseline to go into the database of questions. And then when the data sets come in, the expectations are much higher and there's a more extensive methodology. Not all of them get data sets, however, to be clear, there are a number that do not.
Is it? Yeah. Okay. One last question.
Hi, thank you for your great presentation. You've got a lot of questions that have needed to be tagged. I'm sorry if I missed that, how you do it. You showed like putting in STD and getting the search results. Did you have like a systematic way of like tagging the questions like in groups, or like what was your methodology of like going through like your hundreds, thousand questions? Thanks.
It really was a matter of coming up with search queries that would allow us to do massive tagging at one time. So starting with spreadsheets, we would do something like Affordable Care Act. Okay, everything for Affordable Care Act is definitely going to get insurance. Doesn't matter what else it might get. It might get something about patient-doctor interactions. If the question is, did you talk to your doctor about whether, you know, you're covered under AC, whatever. But it might, but all of them are going to get insurance. So we were doing these massive searches that allowed us to do swipes through. And we just kept doing that and getting more granular. And as I said, we started with spreadsheets, but we've moved to a tool that pulls more consistently. And we did start with the existing topics in iPull. So there weren't a ton of topics comparatively, but we did have topics like alcohol, abortion, end of life, death and dying for the end of life questions. There are things in death and dying that have nothing to do with sort of medical end of life, but those could often be crossed. So multiple topic categories would usually narrow you down. So if you got death and dying and it had a health topic, that sort of crisscrossing of topics could be really targeted and really helpful. Unfortunately, and could have been done in iPull, but unfortunately users don't do it, right? So that would bring you to end of life questions. Did that make sense? We're still working on it. Honestly, that's why I say we missed some things because the wording is so extensive. There's any sort of big sweep is going to miss some stuff. So we're always picking up the bits. But again, as was said earlier, we do not want the perfect to be the enemy of the good. So.
Thank you. Thank you so much, Kathleen. And please join me in saying thank you once again.
Thank you.
So we're moving on to Ryan's presentation. You can screen share if you'd like. So Ryan Womack serves as data librarian for the New Brunswick Libraries, part of Rutgers. And he's currently serving as the head of the New Brunswick Library Research Services Unit. He has published in journals such as the Journal of Academic Librarianship, +1, IASSIST Quarterly, obviously, and Library and Information Science Research, and has presented at many conferences. He's an active member of IASSIST, currently serving as member at large for the USA and the secretary of the association from 2015 to 2019. His academic background includes an MA in economics, an MS in library science, and an MS in statistics and biostatistics. So just like before, we'll just put a little comment in your chat 3 minutes before. The floor is yours.
Great, thank you very much. I'm sorry I couldn't be there in person in Sweden. It's a little sad to see you all there, but I'm hoping that you're all having a good time, and I will be able to join an in-person IASSIST again at some point in the future. So this talk is about diversity in data, and last year, I won't actually go through this outline. I think it's fairly straightforward, just in the interest of time. Last year, I had given a presentation on our graduate specialist program, which is summarized a few years of work to develop a program that provided help with research methods, provided workshops and consultations around topics like Python and R and Tableau. And it was a developmental opportunity for graduate students to also improve their instruction, investigate different areas. It enabled us to make a transition to primarily online workshops during COVID. And there's further information on that last year's talk linked from the slides. Actually, I was going to put the link to today's slides in the chat. As others have mentioned in the morning presentation, we've been through a couple of years where social events have awakened us to a lot of different issues relating to diversity, equity, and inclusion. And we evaluate our graduate specialist program every year to understand new things that we can offer, new things that we can do. And so we identified the diversity angle as an important thing to address in this academic year's program. I want to give a nod to our strategic plan, and I would argue that focus on diversity strengthens all the elements of our current strategic plan. However, our current strategic plan was developed in 2019 and doesn't explicitly highlight diversity in a way that I think our future plans probably will. So our graduate specialists, just a little bit more about them. They are hired from among the advanced graduate students in New Brunswick who already have skills and interests that we'd like to bring to a wider audience. We pay them at a higher wage rate than our normal libraries scale, and that has worked well to address really a variety of things that the libraries would not have been able to do otherwise. So I don't think I need to say too much to this audience to convince you that the issues of DEI are very important in today's society, that all of our historic data work and data collections have issues with representation and interpretation according to race, gender, ethnicity, and other lines. In newer developments with machine learning and artificial intelligence, we have this problem of unexamined bias creeping back in and having our black box models reflecting societal issues back at us. And so that is another angle to this issue. I think it's increasingly coming into focus, but in the past, we could say that some data literacy programs that glossed over these issues are probably need to be ramped up. And I would include our programs at Rutgers in this category because we had, really focused on methods to, with very little mention of things like data ethics and diversity issues. However, we got a start towards this, and I want to kind of caveat this whole presentation that this presentation is about a small starting effort that we'd like to continue. But our ordinary model for a graduate specialist is to hire someone for a 10-hour-a-week position. We viewed this diversity in data as more of a very independent research project for each student, that they would kind of delve into their own investigations and bring back some of their findings. We felt it would be better to multiply the number of people that were doing this. So we split our 10-hour-a-week position into 2 5-hour-a-week positions. We, by at least our Rutgers standards, wrote a job ad that was more sort of explicit about some of the issues that we were looking for. I provide a quote here. So, we highlighted some of the recent works that have taken a more activist approach towards data issues. And interestingly, I think it's one of the really interesting aspects is that in previous years for our data science type positions, we had received maybe 10, maybe 15 applicants. We had several qualified applicants to work from, but the numbers were moderate. And this year for these positions, we received about 35 applications, which was really a high number for us. It somehow hit the computer science graduate students at Rutgers, and a lot of those applicants came from computer science. However, many of the computer science applicants did not really address the diversity aspect effectively in their applications. So that's just something interesting to consider. We ended up hiring across a range of disciplines. So we had computer science, political science, sociology, doctoral students, and master's student in the case of computer science, each of whom sort of took different angles of this topic. And I would probably like to linger on this slide a little bit longer than others, because these were the actual workshop presentation topics that were developed by the diversity in data graduate specialists. So we had one person working on health related issues and in connecting COVID vaccine hesitancy to prior healthcare experiences among Black adults and looking at data sources that would help understand that issue. Our political science person focused on social media and was examining issues of racial justice and police brutality as reflected in Twitter discourse. And that ended up following into some methods things, which I'll mention in an upcoming slide. And our computer science student focused on algorithmic bias and developed kind of a full series of discussing what is it, how does it enter our technologies, what can we do about it, in a series of talks. So that was the what. The how is again relatively straightforward. These were all Zoom workshops. We have found actually that some of us have tried to offer in-person workshops, and there's very little take up for those. We're still primarily online in terms of all of our outreach and presentation. One thing to note is that across the board for all of our workshops, our numbers have been very much down this year compared to last year. Last year, there was an enormous surge of sort of COVID, people looking around for things to do online, interest. And now I think we're at the other end of the cycle with a Zoom fatigue effect. So one of the issues for these presentations was that the numbers for most of them were really quite low, 3 people, 5 people, 7 people attending. And what people ended up being interested in, especially in the case of the Twitter data, was to get more of the methods content. So that's why we agreed to kind of build back in some methods approach, social media analysis. And unfortunately, our specialists, one of them had to ran out of time to work with us because her departmental commitments increased. Another one had some personal issues where she had to step aside for a little while. So we hadn't fleshed them out quite as much as I would have hoped at the beginning of the year, but you can find the materials related to this through our data diversity LibGuide, which has topics on algorithmic bias and social media data, kind of give you a sense of the things that were accomplished. And now I'll take a couple of minutes to talk about some of the other follow-on and where we'd like to go with this in the future. So, because this was independent research, it took some time for the students to kind of get into depth in the topic to be able to present with some interesting findings and authority. So in the fall semester, there was relatively, I think each of our specialists developed one presentation by the end of the fall semester. And as I mentioned, some people had some issues that took them away from their work in the spring. I mentioned already the attendance issue, which I think is partly another angle of that is that I think the audience we market to for our traditional data workshops is not necessarily the same audience that would be interested in the diversity topics. So I think we need to figure out something a bit better for that. Those who did attend returned, and I see the time warning, thank you, returned and to other sessions and had meaningful discussions. So they were pleased with the content. Another issue is that this is sort of a time-consuming thing on the part of the librarian. We have other librarians who work with the specialists, but I was primarily the ones working with these students. And if you're meeting with 3 students each week, as I was for most of this project, it kind of fills up your calendar. But I think we got a really nice start, and we were able to tackle some issues that we had not addressed before. And we would like to have the students continue their work in the upcoming academic year, along with the following things on this slide, to use those initial talks that familiarize people with these topics to move into more open-ended discussion. I think we want to bring in more of the groups who may be most affected by these issues, right, are probably need to be more involved in the development of the dialogue around these topics, including recruitment of specialists and outreach to other groups on campus. We have campus partners, like there's a relatively newly formed Institute for the Study of Global Racial Justice that we could be working with. So we have ways to continue developing this program. We would also like to balance that methods type of interest with maybe diversity examples and data to kind of blend those things a little bit more effectively. I'll just spend a couple moments on this slide to just argue, again, I don't think I have to do that for this audience, that when we talk about data literacy, I think we now need to build more diversity-focused content directly into our outreach and teaching. As I was preparing these slides, I saw that New York Times had this enormous series on Haiti's debt over debt repayment since the Haitian Revolution and how that had weighed down their society. So that's just one example of something that was poorly measured for quite a long time, didn't get a lot of attention, and kind of gets overlooked if you look at Haiti and you say, well, Haiti has an economic development problem that is purely reflected in a low growth rate. Well, there's a lot of other things going on. And I think we also can't talk much about things like algorithmic bias without, and talk about machine learning without getting into algorithmic bias. So let me not go further on that. And what I'm most curious to hear is this audience's thoughts about these issues. How do you work with integrating these topics into your data literacy work? Differences between the US perspective versus the rest of the world, and how we can be more inclusive about such topics in the future. So thank you for listening, and I'll stop sharing here.
Thank you. Thank you so much, Ryan. Questions online or here? Yeah, I was curious. You asked a lot of questions. I guess you do, but have you thought about the birds of a feather session? Because that seems appropriate for.
Yeah, I think I'm realizing, being at IASSIST, that this is definitely a place to start seeding some of those discussions.
Yeah,
that's a great idea.
I think it's tomorrow, but I'm not sure. We can check and tell you. So there's I live only. Oh, sorry. It's just like workshops. We had people who registered, but it was live only also. So no regrets, no questions. I think you can think about it, and we can take questions at the end. As I said, we are a little bit late, but there's a break, so I think we can take 10 extra minutes if you have time.
Okay, thank you. Then we can.
Thank you. Also, yeah, you have a comment, very relevant. Your work is relevant for the racial justice interest group. And thanks, Ryan, a lot to think about, and that's true. So yeah, if you have questions in the end, do not hesitate. And I think we can, yeah, you have a comment. So the York University in Toronto, they're in the process of developing a workshop for graduate students that will help them find and critique published data about racialized populations in Canada. Yeah, so maybe you guys should.
Yeah, and I saw that morning presentation, which was great, and it really talked about, again, how those racial categories in Canada are somewhat different and evolved over time in a different way, which I think is a fruitful area for investigation in the future. So that was great.
Okay, so thank you again, and we'll move on now to our last presentation. Time flies. So our last presentation is from Dany Savard and Minglu Wang. So Dany is the director of open scholarship at York University Libraries in Canada, where he supports the development, coordination, and evaluation of scholar visibility and research data management services. He has contributed to research articles on the topic of research data discovery and data repositories. He's a member of the Portage Discovery and Metadata Experts Group, and he is the current chair of the Portage Canadian Data Repositories Landscape Working Group. And Minglu is an RDM librarian at the same university. She has published book chapters, conference working papers, and research articles closely related to academic libraries and RDM services. She's an active member of the Association of College and Research Libraries and contributed to multiple years of the association's publication of top trends articles and environmental scan white papers, focusing on the topic of research data services development. She's a member of the Research Intelligence Expert Group, former Portage Network, a part of the Digital Research Alliance of Canada. She also participated in the design and report writing of the RDM capacity survey of Canadian institutions, and she's a member of various interest groups within the RDA and guidelines as guidelines on data sharing. So the floor is yours. As we did before, I just like to remind that we'll just put a little comment in your in the chat 3 minutes before the presentation is should be over. Oh, it's no. Ah, you're okay. You're muted.
So sorry.
I
I think everything should be working now. Thank you so much for providing us with the opportunity to present to you this morning on faculty researcher perspectives on RDM and the pedagogical needs of graduate students at York University. So for our time today, we are going to be taking you through a review of our research questions and rationale, what we uncovered in the literature that connected to our questions, the methods we used to analyze our data, the themes and codes we were able to uncover from our data, a few examples of how these connected, and finally, the overarching category we identified from this work. We will complete the presentation by offering our reflections and some conclusions. So first, to give you a brief overview of the context we are operating within, Minglu and I are librarians at York University in Toronto, Canada, which is a large teaching and research university that serves a population of over 50,000 students enrolled in over 200 programs at the institution. Like many of the other Canadian presenters at IASSIST this year, we are working within an RDM policy context that is neatly tied to the requirements of the Tri-Agency Policy on Research Data Management, which is the policy for the main federal granting agencies that fund research in Canada, and which is expected to impact how researchers think about and incorporate data management plans and data sharing amongst other activities within their practice. So at York, we continue to prepare for the requirements of this policy through training, services offered via the libraries and the research office, and an ongoing public consultation campaign involving multiple stakeholders at the university. So one aspect of this work that has been of particular interest to us in this process is how our faculty instructors and graduate students think about RDM pedagogy in their own curriculum planning efforts within their labs, departments, and faculties, and how they think about the libraries and other units on campus, helping them build and integrate this curriculum where they need it most. So in pursuing our interest with this project, we turned to framing our inquiry around the following questions. How are educational or training opportunities in RDM understood by teaching faculty concerned with readying their graduate students for lab, field research, or real-world context? And how do such perceptions influence teaching faculty researchers' views on RDM pedagogy? So now I will turn it over to Minglu to describe what we found in the literature to help us think about existing work on these questions and how we proceeded with collecting and analyzing data for our study.
Yeah, thank you, Dany. So we have reviewed 3 groups of literature, including systematic reviews on research data management services and RDM training. Scholarly articles focused on RDM training for graduate students, and especially a few focus group studies. The literature review provides us with some understanding of the existing RDM training for graduate students, mostly in the United States and during the last decade. It gives us a baseline to compare the results of our own study. Here are a few highlights reported in the literature that we found most relevant to our own topic. We found that educators are gradually realizing the importance of RDM training, but most of the research faculty cannot provide comprehensive training to the graduate students in terms of RDM due to limited time and lack of expertise in the area. RDM training for graduate students has started to become more and more common at universities, though, ranging from workshops offered by the libraries to dedicated RDM courses taught by faculty members or co-taught by faculty and librarians. As we are planning to further engage with our local campus researchers and students in the area of RDM, we thought it will be useful to start conversations with our faculty to find out within Canadians' unique policy context and our local campus environment, how they perceive their roles in RDM training, and especially whether they would like to collaborate with the library in any ways. Focus group study seems to be a good fit because not only we could hear our research faculty's voices, but also we could observe what kinds of discussions could happen among themselves. And we believe this is going to provide a better foundation for our further RDM training or services development. Our data were collected through 3 focus group interviews with 8 participants to encourage interaction between participants and generate data. Potential participants were recruited based on their interest in curriculum development and RDM, their teaching assignments, and their supervisory or mentorship relationships around data management in their own research context. Given the strong interest in RDM from faculty in the social and health sciences, recruitment was limited to faculty researchers working in psychology, sociology, environmental sciences, disaster and emergency management, and nursing for the scope of this project. To ensure participants had a common frame of reference to begin from the focus group context, we provided them with the definition for RDM that were offered in the Research Data Digital Research Alliance of Canada's primer on RDM. After the data gathering, we analyzed the transcripts according to the ground theory method. We went through open coding, grouping themes into categories, gaining consensus on the themes for focused coding, and then trying to identify connections of important categories. Next, we'll be reporting our preliminary findings. I'll pass on to Dany.
Thank you, Minglu. So as Minglu mentioned, our initial coding pass or our open coding stage involved both of us individually identifying common themes between the transcripts of the various focus group interviews. And then we worked to bring those codes together through a process of joined continuous comparison where we looked at where there was a significant overlap and some level of internal consistency in the themes we identified. So what is offered here is a visual representation of that joint collaborative open coding. And so unsurprisingly, given the structure of our focus group questionnaire, we found a concentration of comments that described the perceptions on the current state of RDM training at the university. So that's represented on the left side, and then a concentration of perceptions on the ideal state. So on the current state side, these perceptions were found to more squarely concentrate on the work that was currently being done, creating and refining lab documentation and training to support project-specific data management tasks that participants felt a strong level of responsibility for, given the disciplinary framing of so many of these projects. So on the question of who was doing the work, participants really focused on what issues they felt were most immediately responsible for as principal investigators on large research projects or as instructors with training responsibilities towards graduate students. We also found this led participants to cite a lack of awareness around what they could or should do beyond this, and in some cases, a lack of access to central resources that could help them fill the gap. On the ideal RDM training side, so on the right side of the screen, we found participants wanted more in the form of either centralized support, so customized research consultations and tools, or a short formal course to cover the RDM basics they felt they didn't have the time to cover or wanted to cover. There was also a strong emphasis placed on strengthening students' education around data and research ethics within the context of RDM. And in terms of who would be contributing into these efforts, participants emphasized they could play a role, especially in the case of formal courses designed for their disciplines. But they also cited the need for more centralized support, and they saw RDM librarians as relevant contributors and even project owners in that space. So part of the work involved in our next stage really related to drawing connections between the discrete themes we identified in our open coding, and there were more connections drawn than we have time to go over today in our actual coding, but we want to bring a couple of examples in to show you part of how we arrived at our overarching category for this study. So one connection or example of a connection is we found repeat suggestions of a connection in our coding of the data that mapped how active and passive a role faculty researchers were willing to take in RDM pedagogy and their perceptions of the type of research tasks assumed by graduate students in project work. There are multiple elements we could report on here, but one repeat example of this connection was the notion of faculty signaling they wanted to take greater responsibility in their students modeling effective or responsible data management behaviors when they felt these tasks needed to be undertaken in ways that reflected disciplinary norms. Where there was awareness of other types of RDM tasks that didn't rely on their expertise, the engagement appeared to be more passive in some cases. The selective coding we undertook on this data has helped us uncover a core category that draws in all connections between themes. This connection, this overarching category rather, points to a focus on participants' consideration of needing to integrate RDM literacies in research method courses that are already informed by program curricula. So our identification of this category is meant to include all those that see opportunity for curriculum integration, but also those that see challenges. However, we do see this category as best capturing the full scope of the connections we saw in the data. So I'm going to pass it over now to Minglu to take us through some of our reflections.
Yes, so far our finding from this study is parallel with the results of our literature review. On the one hand, faculty feel they neither have the time nor the expertise to provide the broad kind of RDM training needed. On the other hand, faculty researchers do recognize the value of institutional RDM training for graduate students. Within our own context, research faculty is still uncertain about their own roles in RDM training, all the RDM areas that they should cover. Both the literature that we reviewed and our own experiences taught us that genetic RDM workshops offered by libraries are having a hard time to reach out to graduate students. Better strategies are needed to integrate RDM training into existing graduate programs or curricula. The core category that we extracted from the data suggested both challenges and opportunities exist for the integration at our own institution. Although it emphasizes the perceived impossibility of integrating RDM pedagogy in research methods courses in the current context, faculty do feel a sense of duty towards their own students, but it just seems harder to ask them to do more. In conclusion, it is still early for us to envision integrating RDM content in existing method courses or designing RDM credit courses. If we start to integrate, we will have to find ways of convincing our instructors to consider the value of including RDM in their program or course curricula and help them feel confident to include this topic. We recognize that there is a limitation of our study in terms of a comprehensive understanding of the relevant stakeholders' points of view. We have only considered faculty perceptions and not students' perceptions. Literature shows that faculty's perceptions might be inconsistent with graduate students' practices and perspectives. So more work is required for us to listen to our users and stakeholders. The changing national funding agencies' policy environment and the institutional RDM strategy under development could potentially catalyze the awareness of RDM resources and issues among our users. And this study will help us better prepared to have further conversations on campus, for example, being sensitive to research faculty's limited time and expertise, and paying especially attention to their concerns about research ethics and data security. I think that's the end of our presentation. We welcome questions and especially suggestions of engaging faculty members on campus and the graduate student RDM training from your own experiences. We really appreciate Ryan's presentation as well, which really inspiring in terms of developing a program that's taught by graduate specialists and to the graduate students, which is really helpful as well. Thank you.
Thank you, Dany. Thank you, Minglu. Are there any questions? Yeah, my colleague Vincent has a question. While I'm working, I can say we work in a university in Paris, Sciences Po, and we have the exact same issues. So.
Yes, thank you very much for the presentation. From my experience with teaching students is to have an RDM element inside the class getting accepted by the students. I usually use the idea of the life cycle of the data to show that usually research is only one part of this whole life cycle, and just, this whole idea that data is not given, so it has to come from somewhere to be reality constructed in a certain way, and then it has to be stuck in another way so that other people can also relate to it. And usually I use the idea of interoperability, reusability, and the fact that, according to certain ideas of science, it has to be replicated. And so I think this is kind of usually how I try to start with RDM concerns, or at least start RDM concerns in students' heads.
Tatiana, did you raise your hand? I think you raised it. I don't know if it was a mistake or you really wanted to ask a question. If you do, you can unmute or just write it. Thank you, Bobre. I think it's important to say that Bobre was supposed to be here. He couldn't. In fact, he was the chair. I stepped in at the last minute. But so, any more questions? I know it's the end, but we have a break. I think we can stay for a few more minutes if there are questions, but I guess not. So thank you to everyone who joined online, and to everybody that is here, and thank you to the wonderful presenters. It was really great. It was interesting and interactive, and that's the most important part, I think. Yeah, Jen. I thought she was raising. Thanks. I thought she was raising her hand. I know, Joanne. I don't know if people raise their hands or not, but I think not. So okay, thank you. Yeah. So yeah, thank you everybody. Bye.